Good afternoon. Please go ahead and take your seat. My name is Michael Liu. I'm the Dean of the school, and welcome to the 80th commencement of Berkeley Public Health. And first, I just want to say I am so proud of each and every one of our graduates. Let's give it up one more time for our amazing class of 2025. I love commencement. It's one of those moments that you'll remember for the rest of your life. You'll remember the pomp and circumstance, the walk across the stage, this glorious afternoon when this class of 2025 is together for one last time. But the one thing that I guarantee that you will not remember is the dean's speech. If you don't believe me, let's ask the audience. Okay? If you've been to a commencement before, raise your hand if you remember what the dean said. That's what I thought. So for the past few weeks, I've been fretting about what I'm going to say, refusing to go down as yet another dean whose speech nobody remembers. Now, before COVID, I could just do what most public health deans did at commencement, which spend most of their allotted time answering the one question that many in the audience had, but were too polite to ask. What can you do with a public health degree? But thank God I don't have to do that anymore. If there's one lesson we learned from COVID, it's that the world needs public health. In fact, your timing is impeccable because you're going into public health at a time when the world needs public health more than ever. So when you think of some of the biggest problems facing the world today, when you think of some of the greatest existential threats to humanity in the 21st century, from climate change to future pandemics, from chronic diseases to social inequality, these are all problems that require public health to be front and center in driving solutions. In the coming decade, I can think of no higher calling, no nobler profession, nothing that's going to save more lives and alleviate more suffering than the field that you're about to go into. But then, I'm not telling you anything that you don't already know. So I thought maybe I can just throw a bunch of unsolicited advice at you and hope that one sticks. And believe me, as a Taiwanese American parent, I'm actually pretty good at giving unsolicited advice. But I just wasn't sure how inspiring it would be for me to be telling you at commencement that the ratio of water to rice in a rice cooker should always be 2-to-1, or that blue and gold is always a better look than cardinal red. Sorry, Harvey. So I turned to a trusted source of advice that many commencement speakers turn to, called ChatGPT. It turns out that there are actually lots of good advice out there. I like this list from Jake Tapper of CNN. Be nice to seniors, be nice to children, remember birthdays, never miss an opportunity to charge an electronic device, use two-step verification, stretch before exercising, stretch after exercising, just exercise, and never pay $200 for a pair of jeans. Great advice, but unfortunately, not mine. So over the past few weeks, I had to dig really deep to find out one thing I could say that might actually stay with you. The one thing that could come back to you in those dark moments of self-doubt and despair ahead. And after a lot of soul searching, this is what I came up with. The one thing that I hope you carry with you, especially in your darkest hours. Don't let anyone tell you that you can't change the world. changing the world. That's why most of you came to Berkeley Public Health in the first place. You want to learn how to make the world a better place. You want to help change the world. And over the last few years, our faculty and staff have worked really hard to give you the knowledge, the tools, the skills you need to go out and change the world, to help you develop that sense of agency as a change maker in the world in the most supportive, nurturing environment. But once you leave here tomorrow, things are going to be different. Not everyone out there is going to be rooting for a change maker. There are going to be cynics and skeptics who will tell you that you can't change the world. There are going to be bosses and colleagues who will tell you to just stay in your lane. Don't rock the boat and don't make waves. There are going to be doubters and haters who will harass and threaten you because you're speaking truth to power. And there are going to be those dark days ahead when you feel like nothing you do matters, when you feel like just giving up on the dream of health equity and social justice for all. Now, in those moments of doubt and despair, I want you to remember this one thing. Don't let anyone tell you that you can't change the world, because you can and you will, especially if you remember these 3 pieces of unsolicited advice from your dean. So first, don't be afraid to fail. If you want to be a change maker in the world, failure is an occupational hazard. In fact, if you're not failing enough, you're probably playing it too safe, not taking enough risk to challenge the system to shake up the status quo. And the last thing I want to see is for 581 Berkeley public health change makers to go out into the world just to settle for the status quo. The novelist Arundhati Roy reminds us, historically, pandemics have forced humans to break from the past and reimagine their world anew. It's a portal, a gateway from one world to the next. COVID had laid bare many of our world's deep-rooted problems, from health disparities to economic inequality to social injustice. The last thing we need is to go back to the way things were. Your generation must set the world on a different path, leaving behind, in the words of Ms. Roy, the carcasses of our prejudice and hatred, our avarice, our data banks and dead ideas, our dead rivers and smoky skies, ready to imagine another world and ready to fight for it. So don't be afraid to fail, be afraid not to try. Because the world doesn't change from the sidelines, it changes because of people like you. People who dare to step out of their comfort zone, to challenge the status quo, to say that there's gotta be a better way to do this, and then roll up their sleeves and fight like hell to make it happen. Second, to quote the late Congressman John Lewis, don't be afraid to get into some good trouble. Public health is not for the faint of heart, especially these days, when standing up for diversity and equity can get you derided and dismissed, when standing up for justice and human rights can get you doxxed and deported, and when standing up for science and public health can get you defunded and demonized. These are dark days for public health. But still, we stand and still we rise, not because it's easy, but because it's right. Getting into some good trouble takes practice. It means practicing courage. Courage to speak up when silence feels safer, to hold the line when others capitulate, to stand up by your values and stand up for the most vulnerable, even when your legs are shaking. It means practicing resilience, resilience that picks you up every time the world knocks you down, to find a way out of no way and makes the impossible possible, that endures defeat but is never defeated. And it means practicing hope, hope as a daily act of resistance against cynicism and despair, Hope as the fire within that turns our darkest days into our finest hours. And hope as the refusal to give up on the future worth fighting for. In the words of my favorite boss, President Obama, hope in the face of difficulty, hope in the face of uncertainty, the audacity of hope. Because in the end, that's what it will take to change the world, by practicing daily acts of courage, resilience, and hope, and by getting into some good trouble, necessary trouble. And the last piece of unsolicited advice I'll give is this: don't go it alone. For the kind of problems we're up against in public health, we won't solve them working in our own little silo. You're going to need partners, and not just those in public health, but across sectors, across disciplines, across industries, harnessing the full force of human ingenuity to take on public health's biggest challenges. And not just those who think like you, but people who bring different ideas, beliefs, lived experiences, and even opposing views. Especially now, as public health becomes more politicized and as the nation becomes more polarized, we will need you to go out there into blue states and red states, in urban and rural communities, bring people together, work across differences, find common grounds, keep your eyes on the prize, solve big problems, and get big things done for our community, our nation, and the planet. Now, speaking of community, remember the question I asked you all at orientation about the redwoods? Yeah? Well, I was going to say, of course not, because no one remembers the dean's speech. But here's what I ask. Why do redwoods rarely fall, even though they weigh thousands of tons and soar hundreds of feet into the sky, despite having roots that are just about 6 to 12 feet deep? Their roots, right? It's because their roots grow outward and they intertwine with the roots from other trees. In other words, they hold each other up. Okay? So take a look around you. These are your roots. Your family and friends, your classmates, your teachers, your mentors, and all of us here at Berkeley Public Health, 400 faculty and staff, 1,200 students, 18,000 alums all around the world. We are your community, rooted in common purpose, bonded by shared values, a community of public health innovators, change makers, and arc benders, fighting the good fight every day, everywhere, to bend the arc of the moral universe toward health equity and social justice for all. So in your darkest hours, just remember this: you don't have to go it alone. We will always be here for you, and we will hold you up. So in closing, it's been an absolute honor to serve as your dean. I wish you fail fast and fail often. I wish you get into some good trouble. And wherever you go, I hope you find a community like this one. People who will hold you up just like we always will. People believe that you will change the world just like we always do. And yes, please remember birthdays, change your passwords often, always use two-step verification, and never, ever forget this, that blue and gold is always a better look than cardinal red. Congratulations, graduates. Fiat Lux and go Bears. Now to our main speakers. We have a tradition here at Berkeley Public Health of lifting up the voices of our incredibly talented students. This year, we have selected one graduate student and one undergraduate student to share a few words of reflection and inspiration with you. In the interest of time, instead of reading their bio, I will refer you to the program. This year, I'm pleased to announce that our undergraduate student speaker is Preksha Ringta. And she will be followed by our graduate student speaker, Priya Bhattacharjee. Please join me in welcoming our 2025 student speakers.
Good afternoon, everyone, faculty, friends, families, and most importantly, the incredible UC Berkeley Public Health class of 2025. Let me begin with a question I've been asked more times than I can count. What is public health? It usually comes up at dinner tables or during small talk right after I mention my major. Everyone's faces are a mix of confusion and curiosity. And well, to be honest, I get it, because I wasn't entirely sure myself when I first got here. 4 years ago, I arrived at Berkeley all the way from Mumbai, a city teeming with brilliant healthcare professionals, yet one where pollution, poor city planning, and glaring inequities are still a part of daily life. I came with a hope to understand and address these fundamental issues. I was 17, wide-eyed, eager, and very, very unsure of what I was doing. Like many other freshmen, I was all over the place. I was fascinated by everything, yet completely lost in the swirl of possibilities. But amidst this whirlwind, one thread kept pulling me back: healthcare. Not just in the sense of hospitals and doctors, but in the way health showed up everywhere: in classrooms and city planning, in prevention and research, in policies and protests, and in lived experience and legislation. Eventually, after a little soul searching and possibly a few identity crises, I realized my passion wasn't necessarily about treating illness at the end of the line. It was about tracing it back to the root. It was about understanding the systems, the structures, and the social conditions that shape health long before anyone enters a clinic. And that's when I found public health. The public health major at Berkeley didn't just give me knowledge, it gave me a lens, a way to see the world not just for what it is, but for what it could be. We didn't just ask what's happening, we asked why is it happening, who is it affecting, and how do we build something better? We came to understand that health isn't just the absence of disease. It's a collective, resilient, and proactive system. It's political, it's social, it's economic, and it must be fair. When I came to Berkeley at 17, my parents had every reason to worry about me navigating a new country all on my own. Would I stay safe? Would I be healthy? Would I be happy? But what I found here was more than just a campus. It was a community that took care of me, often in quiet yet powerful ways. The vibrant and walkable campus kept me active. Access to affordable and fresh food meant that I could nourish myself without compromising my health. Prompt health services supported me even in the most urgent times, like the night I had to be rushed to the ER. Our campus police and fire departments were always there, whether it was to escort me home safely at night or showing up again and again for my apartment's overly sensitive fire alarm. There was beauty in the clean air, even when it was unbearably freezing and windy. Uplifting public spaces, mental health circulars reminding us we weren't alone, and professors offering empathy when life got overwhelming. So many invisible forces came together to make sure we felt healthy, safe, and included. And through my public health education, I began to truly see and appreciate it all. I realized this is what systems working together look like. And behind them are public health professionals and advocates making the impossible possible. This is what real health feels like. And still, I don't know if my parents truly know what public health means, even as they watch me graduate today. But they know it means something to me, and that's enough. Thank you, Mom and Dad, for always supporting my decisions, for your unconditional love and support. I owe all my achievements to you. To all my friends and family here at Cal and back home in India, thank you for being the most heartwarming and uplifting community I could have ever asked for. And to the inspirational faculty, thank you for widening my perspectives through your invaluable experiences and guidance. Now, I won't pretend that the road ahead is easy. We're entering a world that's complex, politically polarizing, and often discouraging. But I have faith that the need for equitable and accessible healthcare will always outlast resistance. That truth, care, and justice will always have a place and a voice. And I have faith in us, this class, because I've seen us in action. I've seen my peers lead harm reduction projects, build innovative health technologies, fight for reproductive rights, and challenge deeply rooted systems with courage and grace. I've seen brilliance paired with humility, passion turned into purpose. So, what is public health? It's right here. It's us, the curious, the compassionate, and the relentless. The ones who believe that a healthier world is not only possible, it's necessary, and we're not afraid to build it. So congratulations, class of 2025. The work begins now, and I wouldn't want to do it besides anyone else. Fiat Lux and Go Bears.
Thank you, Dean Liu and Pariksha, and thank you, Mom and Dad. Good afternoon, faculty, family, friends, and fellow members of the class of 2025. Today, we celebrate the 80th commencement ceremony of the UC Berkeley School of Public Health and recognize the dedication and excellence of another exemplary batch of Berkeley public health leaders and changemakers. Congratulations, Bears. Today truly feels like a full circle moment for me. 8 years ago, I sat on the same stage at my undergraduate commencement ceremony. Since then, the world and I have both changed in significant ways. Some changes have been remarkable and exciting, and some have been painful and challenging. But this campus still gives me the same comfort and hope, even 8 years later. Berkeley has taught me so much, and what it couldn't teach me, it prepared me to learn from the world. One of the first things I learned at Berkeley was how to fail. I will never forget sitting in Latimer Hall, crying in the middle of my organic chemistry midterm, trying not to let the tears smudge my sad little carbon ring drawings. I've wanted to rip my hair out debugging R code, or trying to understand the difference between the Beveridge and Bismarck models of healthcare. Let me tell you, failing is not fun. But Berkeley taught me that failing is a privilege. Failure means that you have finally made it to the boundary between what you know and what you have yet to learn. It is the ultimate sign that you are growing. The second most important thing I learned at Berkeley was how to listen. And not just listening in lecture halls, but listening to speakers at student protests on Sproul. Listening to stories of pain, resilience, joy, and growth from our classmates in discussion sections. Listening extra hard for the voices that are silenced and suppressed. History has shown us that times will come when people with a lot of power will try to tell us to stop listening to each other. They will talk over our voices and tell us what they think we need to hear. My fellow Bears, don't fall for the trap. Remember, this campus is the birthplace of the free speech movement. Keep your ears, your hearts, your minds open. Keep listening. Pay attention. Bear witness. Berkeley has helped me achieve my dreams. I knew since I was a little girl that I wanted to be a pediatrician. I deeply appreciated the way that my own pediatricians empowered me to ask questions and advocate for my health and body, even as a child. During my training in pediatrics at Kaiser Oakland, I rotated through clinics, wards, and ICUs, learning from and caring for the children of my East Bay community. I learned to diagnose common pediatric conditions and identify what was causing a child's symptoms. I learned how to come up with treatment plans and how to counsel patients and families. But I also encountered questions that I did not have the ability or knowledge to answer. I embraced a tired mother in the NICU as she asked me why her child was born prematurely while we stood over the incubator watching as a ventilator helped her baby girl breathe. I sat with a family, tears streaming down our faces as they asked why their son's cancer had relapsed when they had celebrated the joy of finishing chemotherapy just a few months prior. I rubbed a teenager's back helplessly as he asked me in frustration why the pain of his sickle cell crisis just wouldn't go away. I did not have the answers for these questions, and to some extent, neither did my medical textbooks or my fellow physicians. But this discipline, the study of public health, can help us understand these whys. In my public health classes at Berkeley, my classmates and I have traveled upstream and considered the implications of environmental injustice, racism, sexism, poverty, education, disability, policy, law, war, genocide, occupation, famine, and human rights on health. We have sought to understand the invisible forces that allowed for the devastation of the COVID-19 pandemic. From the tiniest single nucleotide changes in the genome to the enormous global emissions of greenhouse gases, we have sought to understand why disease occurs, why it affects specific communities differentially, and why it is our responsibility to address these structural determinants of health. So as a physician, I would like to thank you, all of you, from the bottom of my heart, for your perseverance and dedication to answering the whys. Your contributions as public health leaders are incredibly valuable to real people, communities, families, and children around the world, and they will benefit directly from your work. Truly, thank you. In closing, I'd like to share an excerpt from Palestinian-American poet Naomi Shihab Nye's poem, Famous. I want to be famous in the way a pulley is famous, or a buttonhole, not because it did anything spectacular, but because it never forgot what it could do. Fellow Bears, never forget what you can do, because you will all do truly spectacular things for the world. Remember that health is not just the absence of disease. Health is flourishing, thriving, growing, and laughing, freely, safely, and in community with each other. Let our diplomas be our calls to action. Let us do small things with great love, and let us truly live out our motto. Fiat lux, let there be light. Thank you, congratulations, and go Bears!
Thank you, Briksha and Priya. I hope you can see why I am so proud of this amazing class of 2025. Please join me in giving them another big round of applause. Each year at commencement, we honor one or more faculty members for their distinguished record of mentorship with the Zach Savory Mentorship Award, named after one of our most legendary mentors of the school that has ever had, who sadly passed away this last month. This year, we have the opportunity to give this award to not one, but two deserving faculty members who are wonderful mentors, Joe Lunar and Kim Harley. Unfortunately, Kim is not able to make it today as she's marking another important milestone, her own daughter's graduation. But Joe is with us, and I invite him to the podium. Now, as Joe comes up to the podium to receive his award, please take a moment to read all about Joe and Kim's individual accomplishments in the program, and let's give them both a big ovation and all the incredible faculty of Berkeley Public Health. I would now like to invite the current president of our Public Health Alumni Association, Tanya Bustamante, to join me at the podium to present the next award. For more than 40 years, the UC Berkeley School of Public Health has presented the Alum of the Year Award to a distinguished alum. Each of these individuals has been selected based on their outstanding contributions to the field of public health. Each of them exemplifies the inspirational achievements and qualities to which the class of 2025 can aspire. This year, we're honoring Dr. Charlotte Smith, class of 2012. Charlotte is not only an alum, but one of our most beloved faculty members at Berkeley Public Health. Charlotte.
Thank you, Dean Liu and Tanya. I am deeply grateful to be recognized as an alum of the School of Public Health because my experience as a student here changed my life. I enrolled in the Environmental Health Sciences Division almost 20 years ago to gain additional expertise in the public health aspects of drinking water quality. I wanted to shift the focus of my consulting firm from the operations of water systems to the health aspects. My work in rural water systems in Jalisco, Mexico is an example of how environmental justice and public health are inseparable. This work, which sits at the intersection of technology, policy, and public health, reinforces that everyone deserves clean water no matter where they live. And I'm proud that Berkeley gave me the skills and tools to support that goal. As luck would have it, I was offered a lecturer position when I graduated. So as a freshly minted alumna, I started teaching in the School of Public Health in 2012. Teaching at this university has been amazing. The students are engaged, intelligent, and eager to learn. You have challenged me with tough questions, strive to understand how social disparities and inequities influence the interpretation of health outcome data, and why place matters and should be analyzed. You have pushed me to explain complex concepts in a way that can be utilized to influence policy, and why incorporating place and data visualizations are important and useful. My greatest joy is to teach you and mentor you, the amazing graduate students of the School of Public Health and Public Health undergraduate majors. So I have degrees from the University of Michigan, City University of New York, Johns Hopkins Bloomberg School of Public Health, but you know, as do I, Berkeley is a unique and special place. This School of Public Health is student-centered. Your education and your careers are the most important thing to faculty. So now I hope as you go on to your careers and your life, you'll stay in touch not only with each other, but with us, your faculty. Let us know how life unfolds for you as you open the next chapter of your life story. But this award is not mine alone. I share it with you because in a few hours you will officially become UC Berkeley School of Public Health alumni and public health major alumni. So it belongs to you too, because I know you will continue to push for a more just, equitable, and healthy world. Thank you again for this incredible honor.
While I have your attention, by virtue of graduating from Berkeley Public Health, you are automatically a member of our Berkeley Public Health Alumni Association. Please scan the QR code on the back of your program to update your contact information so you can stay connected with us no matter where you are. We have alumni mixers, career workshops, virtual lectures, and much more. And membership is free. Congratulations, graduates, and welcome to the Berkeley Public Health Alumni Association.
Thank you, Tanya. I now have the honor of introducing our commencement speaker, the 25th Secretary of Health and Human Services of the United States, Secretary Xavier Becerra. I invite you to read his bio in the program, but I'll just share this as he comes up to the podium. Secretary Becerra championed the Affordable Care Act as a member of the United States Congress. He defended the Affordable Care Act as California's Attorney General, and he implemented the Affordable Care Act as the Secretary of Health and Human Services. Please join me in welcoming a true change maker who has dedicated his life to the fight for health equity and social justice for all, Secretary Xavier Becerra.
It is good to be home from Washington, D.C. It is nice when you get to see a blue sky, and almost on cue, the baby started crying. And I was smart enough not to wear cardinal red to come to a UC Berkeley graduation commencement exercise. And so I will tell you that you are in the right place. We are in the right place because history is being made today, because the future starts here where you are with these graduates, your family members, your sons, your daughters, your pupils, the people who will change America and will change the world for the better. So thank you for allowing us to join these graduate students today here at UC Berkeley. Dean Liu, to you and the esteemed team at the UC Berkeley School of Public Health, thank you for considering me to join with all of you today. To the parents and families, I remember sitting there, the first in my family to get a university degree. I remember sitting there as the proud father, along with Dr. Carolina Reyes, my wife, who is here with us today, watching as our daughters graduated. To all the parents and family members who are rejoicing out there, congratulations. One more proud moment and one less tuition payment. And of course, most importantly, the extraordinary graduates of the class of 2025. To each and every one of you, as we would say, salud, salud, which aptly means to your health. And here, if I may, I'd like to take a moment on behalf of Carolina, me, and I hope you as well, to send strength and prayers to my former boss, President Joe Biden, to his wife, Dr. Jill Biden, and their family, after the news of President Biden's cancer diagnosis. We wish you, boss, Godspeed, and thank you for letting me send him that message. Okay, so graduates, indulge me for just a moment, because I remember being where you are. Close your eyes, just close your eyes briefly, and take a moment to visualize, the people, the events that made your journey possible. The joys, the hardships, the doubts, the resilience. Okay, now open your eyes. You're here. It wasn't a dream or a nightmare. It's real. It is real. And you know what else? You know what else it is? It is game time. It is game time. For years, and I know your professors will tell you, your parents will say it, I heard it all the time. You've been saying, put me in the game, coach. Put me in the game. I'm ready. Give me the ball, coach. I can score. Well, we're putting you in the game. And it's real. You are the future of public health. The health of our families, our nation, our economy, of the world, literally. It all rests on your shoulders. No pressure, by the way, no pressure. Now, do me a favor. Look at your classmates, those around you. They are now not just your classmates, they are your teammates in the fight for universal quality public health. It's a small world, and you will cross paths more than you can imagine. And the world is guaranteed to throw one public health crisis after another your way. Believe me, I know. Just think, you get to go from pulling all-nighters studying public health to pulling all-nighters saving public health. Yeah, and that's not a joke. That's not a joke. I spent, as Dean Liu mentioned, years in Congress battling alongside many of my colleagues trying to pass the Affordable Care Act. In the wealthiest country in the world, the number of Americans without health insurance was approaching 60 million when we finally succeeded in 2010 to enact the Affordable Care Act. 10 years later, this time as the Attorney General of California, I had a chance, as Dean Liu mentioned, to defend the Affordable Care Act all the way to the Supreme Court, and we won. So when I came to be the Secretary of the Department of Health and Human Services in 2021, you can imagine how anxious I was for Coach Biden to put me in the game, Coach, put me in the game, to deploy the ACA to fight for the millions of Americans who couldn't go to the doctor or take their child to the hospital without fearing that they'd lose their house or go into perpetual debt. By January 2025, after 4 years as Secretary crossing the country and reaching out to uninsured Americans everywhere, even in the middle of the worst pandemic any of us had ever experienced, more Americans signed up for health insurance coverage for their families than ever before. Today, more than 300 million Americans, never achieved in the history of this country under any other president, Americans have coverage for their family the way they've never had it and can go see that doctor. They can take their child to that doctor and not worry about losing their home or going into perpetual debt. That is progress. We need to score more of those touchdowns, and we can't afford to have the team currently on the field in Washington, D.C. fumble away our gains. And this is where you come in. Too many Americans still cannot access adequate care when they need it. Children are again needlessly dying of measles, a disease we work so hard to eradicate. Avian flu is hovering just around the corner. Not far away, Ebola still threatens. And it's as if viruses and bacteria and natural disasters like hurricanes, floods, and wildfires weren't enough, we also have to contend with man-made disasters. Why is the federal government halting medical research that helps fight cancer? Why did the federal government shut down CDC collection of injury prevention data that helps us tackle child abuse, drownings, and car crashes? Why is this administration slashing funds for Meals on Wheels for seniors in America? And why did they pull America out of our partnership with the World Health Organization at a time when the world needs more, not less collaboration to stop disease and death from spreading, including to our shores? We need you. Will you hurry up and grab that diploma, even though it's not the real deal? Your time at Berkeley has been shaped by an institution renowned for its legacy of social justice, its pioneering research, and its unwavering commitment to health equity. And you're not afraid to say those words. You have been challenged to think critically, to question assumptions, and to master the complexities of public health in a rapidly changing world. You have delved into the intricacies of health policy, epidemiology, environmental health, social and behavioral sciences, and biostatistics. Have you all figured that one out yet? I'm still trying to figure that one out. You have grappled with social determinants of health. You recognize that health is not merely the absence of disease, but a fundamental human right. One that is inextricably linked to social, economic, and environmental factors. The world you are entering faces unprecedented challenges. We may not get to choose the challenge that we face in our time, but we do get to choose how we meet it. In the U.S. today, Black and Indigenous women are 2 to 3 times more likely to die from pregnancy than white women. 9 out of 10 Americans believe that our country is experiencing a mental health crisis. Drug overdose deaths surpassed 110,000 in 1 year with the onset of the COVID pandemic. Extreme heat and the escalating climate crisis are leading to superstorms, major flooding, urban wildfires, and devastated communities. These challenges demand innovative solutions, collaborative action, and a deep commitment to social justice. Remember, you're not just inheriting these challenges, you're inheriting the opportunity to solve them. That was our mindset when I was secretary at HHS. For the women that I just spoke of, who anxiously faced the pressures of motherhood with their new babies, we extended Medicaid postpartum care from just 60 days for the entire year to 365 days for the year. For Americans experiencing a drug overdose or mental health crisis, we launched 988. Think 911, but for those experiencing mental substance use crises. It's a nationwide 3-digit number that serves for those who are about to take the wrong fork in the road. We made Narcan, which you may know as naloxone, which can save and reverse death when it reverses an opioid drug overdose. We made Narcan available over the counter because it works and it saves lives. And I hope you've heard the news. Last year in 2024, drug overdose deaths dropped by 27%. 30,000 fewer sons and daughters who died senselessly here in America last year, the largest one-year decrease ever recorded on our watch. To further move our healthcare system from one that principally treats illness to one that promotes wellness, HHS has championed to become a partner in the Food is Medicine movement. I needn't say more. Food is the best medicine your children can take. Our work at HHS and our successes were not a matter of luck. They were not accidental, and they were not easy. They were intentional. We chose to meet the challenge. And you have chosen a path that is not always easy and often unseen, but it is undeniably vital. The well-being of communities, the pursuit of health equity, the prevention of suffering. That's your choice, and it speaks volumes of who you are. So be intentional. Remember the values that have guided you here. Equity. Strive that all have the opportunity to achieve their full health potential. Evidence. Ground your practice in rigorous science. Community. Engage, respect, and empower the people you serve. Action. As Master Yoda perhaps put it best to Luke Skywalker, try not. Do or do not. There is no try. And the value of resilience. Attack your work with ganas. Okay, don't look it up. Yeah. For those who know it, explain it, because if they look it up in the dictionary, it'll say desire. No, come on. Ganas is guts, grit, and game, all rolled together in one. Ganas. Have the resilience. Have ganas. Amen. Si se puede. Si se pudo. What should I say? Graduates, you are stepping into a world that needs your passion, your integrity, your courage. As you stride forward and accept your diploma, carry with you the spirit of Berkeley. Lean forward. Lead with passion and compassion. Leave no one behind. Public health done right packs the power to improve lives, to transform societies. You are now officially part of this proud tradition. You are in the game. Now, it's up to you to wield your superpower. No pressure. Just get it done. Thank you very much. And success to you always.
All right, well, thank you so much, Javier, for those absolutely inspiring words. Now, we've come to the part of the ceremony that you've been waiting for, the conferral of degrees. I'd like to ask our faculty directors to please come forward for the presentation of our graduates. And I'd like to ask all the graduates and families to please stay until the end of the ceremony. Each student walking across the stage has worked incredibly hard to get here, and they each deserve to be celebrated. So let's honor every single one of them all the way through the end to the last name called. That's the Berkeley way, and plus the reception food line won't open until the last degree is handed out, so there's no point trying to beat the rush. All right, let the conferral degrees begin.
Okay. Dean Liu, it is my pleasure to present Purba Chatterjee, who is receiving a degree in Doctor of Public Health, and dissertation title is Under Suicide, Bereavement, and Impact of Stigma on Help-Seeking Behavior in Kenya. Their dissertation chair is Dr. Ndola Prada, who is hooding them. Dean Liu, it is my pleasure to present Renee Clark, who is receiving a degree in Doctor of Public Health, and dissertation title is under Reimagining Postpartum Care for Black Birthing People in California. Improving Models of Care and Policy Implications. Their dissertation chair is Dr. Ndola Prada, who is hooding them. Dean Liu, it is my pleasure to present Blake Earhart Oren, who is receiving a degree in Doctor of Public Health, and dissertation title is under Measuring Maternal Mortality Due to Abortion Complications in Forcibly Displaced Populations. Their dissertation chair is Dr. Ndola Prata, who is heading them. Dean Liu, it is my pleasure to present Silvana Larea Scaivon, who is receiving a degree in Doctor of Public Health, and dissertation title is under Access to Sexual and Reproductive Health Services Among Undocumented in-Transit Migrant Women in Mexico, Challenges and Opportunities from a Systems Perspective. Their dissertation chair is Dr. Sylvia Gendelman, and they are being hooded by Dr. Jay Graham. Dean Liu, it is my pleasure to present Juan Nurul Nazira Binti Mohammed Zainal Abidin Arif, who is receiving a degree in Doctor of Public Health under the dissertation title Vaccine Confidence and Infodemic in Southeast Asia's Nusantara Sociocultural Sphere, Human-AI Collaboration in Infodemiology and Pre-Debunking as Solutions. Their dissertation chair is Dr. Leila Kwong, and she's being hooded by Dr. Kwong. Dean Liu, it is my pleasure to present Morgan Nguyen Vien, who is receiving a degree in Doctor of Public Health, and dissertation title is under Precision Public Health for Prevention of Chronic Diseases, Artificial Innovation, and the Roles of Cross-Sectoral Partnerships and Governmental Policies. The dissertation chairs are Dr. Linda Newhauser and Dr. Darlene Francis, and she is being hooded by Dr. Newhauser. Dean Liu, it is my pleasure to present Ida Wilson, who is receiving a degree in Doctor of Public Health, and dissertation title is under It Affects Us Too, the Public Health Effects of Police Violence Impacting Black and Latina Women. Their dissertation chair is Dr. Denise Hurd and is being hooded by Dr. Hurd. Dean Liu, it is my pleasure to present Emily Catherine Weiner, who is receiving a degree in Doctor of Public Health. Dissertation title is under From Creative Expression to Collective Action, the Use of Arts-Based Methods in Youth Participatory Action Research. Their dissertation chair is Dr. Emily Ozer and is being hooded by Dr. Jen LaChance.
Dean Liu, it's my pleasure to present Kevin Benak, who is receiving a degree in Doctor of Philosophy in Biostatistics, and his dissertation title is under Unified Analysis of Two-Stage Experiments from the Design-Based Perspective. Their dissertation chair is Dr. Peng Ding, who's hooding them. Dean Liu, it's my pleasure to present Yunwen Ji, who is receiving a degree in Doctor of Philosophy in Biostatistics, and dissertation title is under Targeted Learning for Robust Inference and Applications in National Clinical Cohort Collaborative. Their dissertation chair is Dr. Alan Hubbard, who is hooding them. Dean Liu, it's my pleasure to present Youngming Serafina Shi, who is receiving a degree in Doctor of Philosophy in Biostatistics, and dissertation title is under Advanced Biostatistical Machine Learning for Complex Biomedical Data, Causal Dose Response Curve Estimation, ICU, EHR bias and missing data evaluation, and cancer drug biclustering and response prediction. Their dissertation co-chairs are Dr. Haiyang Yuan and Dr. Alan Hubbard, and they're being hooded by Dr. Hubbard. Dean Liu, it's my pleasure to present Lei Shi, who is receiving a degree in Doctor of Philosophy in Biostatistics, and dissertation title is under Design-Based Causal Inference for Randomized Experiments, a Unified Framework for a Diverging Number of Treatment Arms and Varying Sample Size. Their dissertation co-chairs are Dr. Peng Ding and Dr. Yingxing Wang, who are jointly hooding them. Oh, really? Dean Liu, it's my pleasure to present Mingyu Zhang, who is receiving a degree in Doctor of Philosophy in Biostatistics, and dissertation title is under Advancing Statistical Methods and Applications for Complex Systems. Their dissertation co-chairs are Dr. Peng Ding and Dr. Luxin Li, and they're hooded by Dr. Ding. Dean Liu, it's my pleasure to present Yunxi Zhu, who is receiving a degree in Doctor of Philosophy in Biostatistics, and dissertation title is Under Robust Inference and Interpretability in Complex Statistical Models, from Model Distillation to Targeted Learning. Their dissertation co-chairs are Dr. Giles Hooker and myself, and Dr. Mark Vendelaan, and I am hooding them.
Dean Liu, it is my pleasure to present Mahfouza Islam, who is receiving a degree in Doctor of Philosophy in Environmental Health Sciences, and her dissertation title is under Illuminating Exposure Pathways for Infectious Disease Transmission in Low and Middle Income Countries, with a focus on South Asia. Their dissertation chair is Dr. Leila Kwong, who is hooding them. Dean Liu, you're going to hear me say this a few times. It is my pleasure to present Christopher Laboa, who is receiving a degree in Doctor of Philosophy in Environmental Health Sciences, and dissertation title is under Mitigating Airborne Exposures to Environmental Health Hazards in Bangladesh. Their dissertation chair is Dr. Leila Kwong, who is heading them. Dean Liu, it is my pleasure to present Wenxin Liu, who is receiving a degree in Doctor of Philosophy in Environmental Health Sciences, and dissertation title is under Household and Ambient Air Pollution Exposure and Children's Health Outcomes. Their dissertation chair is Dr. Ellen Eisen, and they are being hooded by Dr. John Balms. Dean Liu. It is my pleasure to present Mayela Therese Padilla Salas, who is receiving a degree in Doctor of Philosophy in Environmental Health Sciences, and dissertation title is under Understanding Workplace Hazards While Remediating Legacy Uranium Mine Waste in Cove Chapter, Navajo Nation. They are the 2025 recipient of the Mary A. Minkler Award. Their dissertation chair is Dr. Catherine Hammond, who is hooding them today. And Dean Liu. It is my pleasure to present Nicolina Wales, who is receiving a degree in Doctor of Philosophy in Environmental Health Sciences, and dissertation title is under Population-Based Studies to Characterize Antimicrobial Resistance Dynamics and Acquired Immunity to Escherichia coli and Shigella. Their dissertation chair is myself, and I'm hooding them.
This is what being a part of those Redwoods looks like. My glasses broke this morning, but Jay has my back. This is what you do for one another. All right, Dean Liu, it is my pleasure to present Kevin Chen, who is receiving a degree in Doctor of Philosophy and Epidemiology. The dissertation title is Statistical Methods for Epidemiologic Inference with Applications in the UAW GM Auto Workers Cohort. They are the 2025 recipient of the Warren Winkelstein Award for Excellence in Epidemiologic Research. Their dissertation co-chairs are Dr. Patrick Bradshaw and Dr. Ellen Eisen, and they have been hooded by Dr. Bradshaw. Dean Liu, it is my pleasure to present Laura King, who is receiving a degree in Doctor of Philosophy in Epidemiology. The dissertation title is Estimating Stereotype Distribution and Vaccine Preventable Burdens in Non-Invasive Disease Caused by Streptococcus pneumoniae. Their dissertation chair is Dr. Joe Lunard, who is hooding them. Dean Liu, it is my pleasure to present Anna Parker, who is receiving a degree in Doctor of Philosophy in Epidemiology. The dissertation title is Investigating Infections and Interventions, Insight into Adult Pneumococcal Carriage, Doxycycline Prophylaxis, and STI Screening Strategies. Their dissertation chair is Dr. Joe Lunard, who is hooding them. Dean Liu, it is my pleasure to present Eric Stewart, who is receiving a degree in Doctor of Philosophy in Epidemiology. The dissertation title is Residential Proximity to Oil and Gas Wells and Risk of Childhood and Adolescent Leukemia. Their dissertation co-chairs are Dr. Patrick Bradshaw and Dr. Catherine Metier, and they are being hooded by Dr. Bradshaw. Dean Liu, it is my pleasure to present Marissa Mugia Sai, who is receiving a degree in Doctor of Philosophy in Epidemiology. The dissertation title is Social and Nutritional Determinants of Health Across the Life Course, Longitudinal Patterns and Policy Implications. Their dissertation chair is Dr. Barbara Laraya, who is hooding them. Dean Liu, it is my pleasure to present Defna Salen Yilmaz, who is receiving a degree in Doctor of Philosophy in Epidemiology. The dissertation title is Investigating Genetic and Environmental Contributions to Autoimmune Disease Pathogenesis Using Genomic and Computational Approaches. Their dissertation chair is Dr. Lisa Barcelos, who is hooding them.
Dean Liu, it is my pleasure to present Madeline Adey, who's receiving a degree of Doctor of Philosophy in Health Policy with the dissertation title Under Use of Force in Carceral Facilities, Addressing a Hidden Health Policy Issue in California. Their dissertation chair is Dr. Stefano Bertozzi, and I am hooding them. Dean Liu, it's my pleasure to present Christine Lowe, who's receiving a degree in Doctor of Philosophy in Health Policy, and dissertation title is under Medicaid Managed Care, an examination of managed care plans and patient engagement. Their dissertation chair is myself, Amanda Brewster, and I am hooding them. Dean Liu, it's my pleasure to present Solis Winters, who's receiving a degree in Doctor of Philosophy and Health Policy, and the dissertation title is under Addressing Structural Barriers to Health in Low-Income Settings, Evidence from Interventions Targeting Vulnerable Populations. Their dissertation chair is Dr. Leah Fernald, who is hooding them.
Dean Liu, it is my pleasure to present Claire Mastrangelo, who is receiving a degree in Doctor of Philosophy in Infectious Diseases and Vaccinology, Infectious Diseases and Immunity, and dissertation title is under Molecular and Clinical Epidemiologic Investigations of Infections Caused by Uropathogenic Escherichia coli. Their dissertation chair is Dr. Jay Graham, who is hooding them. Dean Liu, it is my pleasure to present Kishan Patel, who is receiving a degree in Doctor of Philosophy in Infectious Diseases and Immunity, and dissertation title is Under Defense and Counter-Defense, How a Genetic Element Encoded by Vibrio cholera Restricts Phage and How the Phage Evolves to Overcome Inhibition. They are the 2025 recipient of the Beatty Memorial Award. Their dissertation chair is Dr. Kimberly Seed, and she has hooded them.
Where's Mark? Mark Van Leer? Mark. Masters, yeah. Yeah, you go over there. Okay.
Sorry. Dean Liu, it's my pleasure to present the following students who are receiving the degree of Masters of Arts in Biostatistics. Sylvia C. Cheng. Alisa Gordon. Yichen Xu. Jiffy Song. Rita Liu. Luis Enrique Dominicus Sala. Quinn Gavin. Xuxin Mao. Sebastian Ong Asmond. Alec Rutherford.
And you're good.
Okay, those last three were EHS. Let's give it up for EHS. Eileen Tai. Ergonomics. Rachel Thero. Runkang Kenny Wang. Rachel Wu. Some more HS folks. This is the Master of Public Health, Environmental Health Sciences, Industrial Hygiene, Anake Khan. Madeline Anling Sit. Elena Sewell Seiler. Master of Public Health, Environmental Health Sciences, Global Health and Environment, Juliana Guinevere Eisinger Bartels. Nola Chen. Leah Chioni. Yuchen Gao. Virginia Pook. Master of Public Health, Environmental Health Sciences, Global Health and Environment, Master of City Planning, Laurel Dinier. Sofia Esteva.
Dean Liu, it is my pleasure to present the following students who are receiving the degree of Master of Public Health in Epidemiology. Carmen Javier. Tyler Graham Martinson. Jenny Marie Linder Rimpel. Francisco Zapita. Dean Liu, it is my pleasure to present the following students who are receiving the degree of Masters of Public Health in Epidemiology and Biostatistics 4+1. Nikki Kadengai. Sarah Henry. Kristen Urim Kim. Christina Peru Lin. Paula Marquez. Edward Morera. Mikko Nargaswin. Amber Peak, winner of the 2025 Sheldon Morgan Award. Kirthana Ramaswamy. Shukri Sahir, winner of the 2025 Henrik Blum Award. Elena Tung. Christian Yoon.
Dean Liu, it is my pleasure to present the following students who are receiving the degree of Master of Public Health in Epidemiology and Biostatistics. Jocelyn Iris Castillo. Harjus Dillon. Maya Freeman. Marissa Fujimoto. Fernando Hernandez Jr. Sheila Ho. Sophia Horiuchi. David Xiaowei Su. Marira Kibea. Stephanie Loja Munoz. Sierra Loomis. Elijah Martinez. Angela Amy Mora. Stella Morris Olubube Wihim. Jillian Renee Paul. Heather Shin. Theo Snow. Clara Vong. And Jennifer Wong.
Dean Liu, it's my pleasure to present the following students who are receiving the degree of Master of Public Health and Health Policy and Management. Emma Bergen. Madison Shays. Sarah Gao. Maria Angelica Garcia Chin. Evelyn Marie Gutierrez. Caroline Daye Gion. Vig Kartik. Eloisa Lopez Valencia. Lauren Nicole Major. Melanie Nixis. Alicia Morris. Elizabeth Resenti. Julia San Juan. Now Sato. Molly Warner. And the degree of Masters of Public Health and Master of Business Administration and Health Policy and Management. Olivia Halas Diaz. Rogerio Rios. Diego Pineda.
Dean Liu, it is my pleasure to present the following students who are receiving the degree of Masters of Public Health in Infectious Diseases and Vaccinology. Clark Cutler. Rain Dragovich. Arlette Annalie Escoto. Isabel Henley. Sage Kang. Deirdre Lemoyne Valenzuela. Ana Dominique Francisco Loquito. Maximiliano Aaron Mendez. Ingvild Norstad. Nora Oyama. Mike Pistono. Roma Renate. Emerson Smith. Sveta Thiagarajan. Chumeng Yang.
Dean Liu, it is my pleasure to present the following students who are receiving the degree of Masters of Public Health in the Interdisciplinary Program. Kay Anderson. Sadaf Ashtari. Umyina Bashir. Priya Bhattacharjee. Urja Desai. Kweku Gate Jen. Yongping Fan. Melania Gomez Rodriguez. Chandni Jain Tersis. Tuzu Mavrumba. Haley Powell. Rajanpreet Singh. Diana Valdivia. Jimmy Haojian Zhao. And Chelsea Jin.
HSB, 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 HSB. Dean Liu, in case you forgot our dean today. It's my pleasure to introduce the graduating students from our MPH program in HSB, Health and Social Behavior. Woo! Meghana Amula. Elisa Natalia Borgsdorf. Alice Bruno. Eva Luz Cordero. Annabel Vidanes Jimena. El Shea. Brooklyn Mercado. We're just a little bit extra in HSB. Alyssa Sampson Moreno. Shivani Nishar. Next, for our students earning their degree in our MPH and Masters in Social Welfare program in Health and Social Behavior. Divya, it's not Divya. Aisa Cabrales. Aisa Cabrales, everyone. Tiffany Lizette Castillo Fret. Ellen Chang. Mariah Odujenrin. And not least, or last, Selena Tran. Celine Tran. Thank you.
Dean Liu. It is my pleasure to present the following students who are receiving the degree of Master of Public Health in Maternal, Child, and Adolescent Health. Molly Adams. Abigail Cruz Reyes. Indira D'Souza. Esmeralda Ruiz Navarro. Julia Picarillo Strasser. Jaslyn Kirsten Braggio. Richa Ruwala. Selena Yu. And in our 4+1 MPH program, Hallie Sullivan.
Dean Liu, it is my pleasure to present the following students who are receiving a Master's of Public Health in Food, Nutrition, and Population Health. Taloa Ivan Cardinal. Anne Doe. Maya Ezekiel. Alina Xiaojin Lei. Elizabeth Lampe. Ursula Lochner Bravo. Arjun Sridhar Mehta. Jessica Liliana Raquel. Romy Kate Takara. And the following are in the 4+1 program. Eisen Nicole Malvar. Vanshika Sharma.
Dean Liu, it is my pleasure to present the following students who are receiving the degree of Masters of Public Health in the online program, Epidemiology and Biostatistics. Kelly Renee Carmona. Serena Chalk. Seema Desai. Vincent Dohan. Regina Endoso. Nicole Fernandez. Jennifer Gorman. Renita Hermes. Katerina Luchnikov. Kimberly Michelle Chavez. Amy Lowe. Alyssa Nuhan Duquin. Vanessa Pan. Tamara Panjalingam. Stephanie Pass. Dr. Moira Rashid. Anna Sanderson. Shirley Sway. Jean Vareles. Angelina Yadel.
Dean Liu, it is my pleasure to present the following students who are receiving the degree of Master of Public Health in the online program Food, Nutrition, and Population Health. Dominique Raquel Anderson. Sammy Nazal. Michelle Park. Michelle Wan.
Dean Liu, it is my pleasure to present the following students who are receiving the degree of Master in Public Health in the online program, Health Policy and Management. Odina Alfaro Morales. Gracie Tatiana Newbargen. Joseph Choyu Chan. Anthony Del Cid. Elizabeth Gomez. Grace Hernandez Melgara. Roxana Pega Hosseini. Angelica Ruby Leon. Antoinette Helbuena. Edgar Alejandro Martinez. Brianna Nielsen. Jordan Rhinesmith. Annika Sabaratnam. Yushinde Shakira Youssef.
All right, Dean Liu. It is my absolute pleasure to present the following social change professionals who are receiving the degree of Master of Public Health in the online program Interdisciplinary. Yariha Abbas. Lauren Carter Adams. Rutendo Ajayi. Hope Brianna Delgado. Claudia Espino Romero. Kelly Hutchinson. Usha Jane. Eugene King. Chalet Irene Lewis. Liliana Loaiza Salazar. Noemí Mauricio Jiménez. Rio Valentín Lubin Molina. Tiffany Wynam Leno. Kamapreet Kaur Pada. Angie Pham. Nu Tuk Trin. Estefanía Cristina Vu. Imana Wasim. Charisse Wynn. So I want to take a moment to say congratulations to our graduate students. Please be sure to retake your seat in the theater as we honor our undergrads next. It takes a village. We need everybody out there. After they have had the chance to cross the stage, Dean Liu will confer your degrees, and we will all celebrate as you turn your tassels. After the conferral of degrees, we welcome you to attend the reception under the campanile, which starts after the ceremony here at the Greek has finished. Congratulations, everyone.
And now our undergraduate.
Alessi Avaz. Sofia de la Rocha. Juliette Delcourt. Nare Haratunyan. Sophia Marnie Hatfield. Yasmin Kadash. Nathra Kaushik. Aiden Lee. Katie McDermott. Christina Nguyen. Thin Rati U. Apurva Pense. Ivan Rodriguez Beltran. Sabrina Spatny. Foz Abdelatif. Ikansh Agrawal. Alina Akeli Chetri. Iman Akila. Isabella Alcocer. Caitlin Alvarez.
Isabella Alcocer.
Aliana Renee Ramos Asuncion. Yesenia Avila Aragon. Natalie Gassia Varujan Ivazian. Richard Julian Bagay. Evelyn Batchelor. Sarah Marie Bates. Nishita Belur. Maxwin Bale. Leah Baruch. Chloe Boss. Mia Cacho. Emmett Campbell. Alma Gabriela Castillo. Kiana Castro. Nicole Chan. Parneet Kaur Chima. Natalie Cheng. Shivali Chikaswamy. Seong Wan Chung. Juliana Colado. Sophia Cowan. Daphne Cruz Rodriguez. Samantha Mira Ramos Cruz. Olivia Quaresma. Francesca Caitlin Dao Hiwang. Madison Brooke Martinez David. Aiden DeLaced. Isabella Diaz Ibarra. Kalia Dorion. Mindy DeWong. Adriana Ellard. Leonel Espinoza. Lisa Yoon. Sarah Fiveash. Allison Karimi Folgar. Grecia Garcia. Lisbeth Sanchez Garcia. Nancy Marlene Garcia. Caitlin Gaspar. Catherine Geisler. Arhant Krishna Ganta. Ali Jiang. Monica Gergis. Kieran Glass. Cecia Gomez Marcelino. Lauren Gonzalez. Gauri Gorsi. Ellie Ham. Abdullah Hamouda. Mia Haven. Leilani Hernandez. Joanna Herrera Cortez. Kelly Higa. Laura Ho. Rachel Hong. Alina Huang. Isabel Andrea Huang. Ashley Huerta. Samira Nassim Hassan. Carolina Ibanez Cuadra. Rosella N. Ibe. Hava Asia Casimiro Isray. Trent Johnson. Benicia Jude Jose. Dia Callan. Patil Kamakian. Jasleen Kang. Jessica Kaplan. Sachita Kanal. Christina Yean Kim. Eliana Kim. Lucy Kim. Audrey Isabel Coe. Catherine Kussler. Chun Fung Kwok. Sarah LaPointe. Tiffany Lay. Trish Lowe. Mateo Lee. Olivia Lee. Sophia Lindquist. Christian Mangosing Lizaso. Dreen Lopez. Lyndon Lovett. Colin Michael Magpock Lowry. Long Shuyan Lee. Nadia Mahida. Tessa Peloso Mahone. Linnell Mack. Andrea Maldonado. Rihanna Manuel Malig. Eric Manuki. Itzel Kimberly Martinez Gonzalez. Gabrielle McDowell. Ria Mehta. Cassandra Mendoza. Erica Mendez Ramos. Kendi Mendoza. Neha Mehta. Ariana McFarlane. Klutbert Mogbatu Tabot. Raymond Mo. Rochelle Aimee P. Monis. Amy Moithia. Isha Narayanan. Brittany Lee Wynn. Darlene Wynn. Tao Ni Phan Wynn. Melody Ning. Emariel Kutar Obero. Diana Orozco. Mia Palacios Hayertel. Giselle Patino. Mia Patzakis. Andrew Pereira. Valerie Aleli Pimentel. Bianca Isabel Poblano Martinez. Vivian Ramirez Rodriguez. William Xavier Reed. Anali Reyes Reyes. Anais Roata. Angie Padzong Tao. Darren Mokong Tao. Ella Trinan. Leah True. Belen Lilia Trujillo. Joyce Trong. Rikio Tsuyama Dahlgren. Jasmine Ajani Turner. Neo Joshua Wynn. Mia Nicole Valenzuela. Brock Vargo. Noemi Vega. Theory Fan. Dudu Tang. Olina Tan. Ariel Susanto. Evan Sun. Amy Sullivan. Caitlin Monica Subishendo. Preeti Subaya. Hunter Sturdivant Lee. Kayla Ann Stevens. Cyril Ishi Pagya Soriente. Nehal Sindhu. Daleen Sidhu. Anushka Shukla. Meru Shankar. Noe Trinidad Serrano. Eliza Shear. Anika Saxena. Anisha Savarala. Janet Sanchez. Estrella Sanchez Morfin. Waverly Espinosa Salvador. Camila San Juan. Anek Karam Singh Sahota. Sarah Pham Rosenblatt. Wendy Pau Rosales. Preksha Rongta. Madeline Zucchini. Liana Yu. Alex Jisung Yu.
Alice Yao.
Serafini Wang. Alexandra Yanez. Vicky Wu. Shinyi Stephanie Wu. Yvonne Wang. Serena Wang. Morgan Wang. Nishta Yogesh Walland. Daniela Villegas. Jada Velasquez Medina. Corey Herrera. Emmanuel Rodriguez Morales. Fatima Zuhra Zamani. Christina Zambrano. Emily Zhang.
All right, now is the time to make all your degrees official. Will the graduates please rise? By the virtue of the authority vested in me by the President and Chancellor of the University of California, I grant you the degree of Doctor of Public Health. Doctor of Philosophy. Master of Arts. Master of Science. Master of Public Health. And Bachelor of Arts. You can take your tassel and move it from the right to the left. Please join me in congratulating this amazing class of 2025. This concludes our ceremony. After the recessional, please join us for a reception in honor of our graduates at the Campanile Esplanade. Will the faculty and all of our guests please rise? We're going to let the graduates exit first, and let's give them a standing ovation as they go out into the world to fight for the health equity and social justice for all. Congratulations, graduates. Go out and make us proud. Fiat Lux and go Bears!